Welcome back to the deep dive. Today, we're really diving into something pretty personal.
Hmm.
It's a personal story about recovering from a really serious illness. And we could talk for hours about like all the drama and the crazy things that happen when someone's going through something like that. But we're going to kind of zero in on something specific. Today's deep dive is really all about the less obvious, the less talked about medical stuff that the author experienced while they were recovering, still in the medium care unit.
Wow. Okay.
So specifically, we're going to try to kind of like untangle this surprising diagnosis, adrenal insufficiency, and it was triggered by something you wouldn't think would be a big deal, the author's skin tone. Like, who knew? Right. And then we'll get into the realities of what it's like to wear pressure garments. And I don't just mean the physical discomfort, but also, kind of the emotional baggage that comes with that. So let's unpack all this. I'm kind of curious. What stood out to you when you were reading through this?
Well, I think it's fascinating how something uh, as simple as someone's skin color can be like a major clue. It can be a major clue when you're diagnosing a complicated medical condition. It's kind of like a medical mystery.
Oh, for sure.
And it really shows you just how connected everything is in the body. All the systems.
Yeah, the author mentions like a doctor coming in to check on them, and the doctor notices their skin looks tan, and they weren't exactly catching any rays in the hospital. So it makes you think like, how often do we miss these little things, these tiny details that could actually be important?
Oh, totally. And in this case, that simple observation about skin color, that led to this whole diagnosis of adrenal insufficiency. So it's basically a condition where your adrenal glands, those are these tiny little organs that sit right on top of your kidneys, they just aren't producing enough hormones.
Okay, so for those of us who aren't doctors, could you maybe explain what exactly the adrenal glands do and how they could be affected by like a major illness?
Well, you can think of your adrenal glands kind of uh, like your body's alarm system, right? They pump out all these hormones, cortisol, adrenaline, things like that. And those help us respond to stress. They regulate metabolism. They even control things like blood pressure and, yep, you guessed it, skin pigmentation.
So when the author was first treated, for Waterhouse-Friderichsen syndrome, which, by the way, listeners, is a super rare but like really dangerous infection, they were given steroids, and that ended up messing with their adrenal glands.
Exactly. Steroids can actually suppress the adrenal glands. So when the author stopped taking the steroids, boom, adrenal insufficiency.
Makes sense. But I gotta ask, I mean, how often does this kind of thing get misdiagnosed? I mean, most people, they're not going to connect skin color to a hormone problem, right?
You'd be surprised. It happens more than you think. Adrenal insufficiency, it can be really tricky to diagnose because the symptoms, things like fatigue, weakness, low blood pressure, those can look like a lot of other
Yeah.
conditions. So you really got to be paying attention.
So in this case, it was really the doctor's, I guess you could say, curiosity about the author's skin that led to this whole diagnosis. It just goes to show that, you really got to advocate for yourself. Speak up if something feels off, even if it seems small.
Oh, 100%. And what's interesting here is that, more testing, further testing for this adrenal insufficiency, it actually got delayed. And it got delayed because the author's wound care, it was so intense at that point. I mean, remember they were dealing with these severe burns.
Yeah.
It just shows how complex this whole recovery process was.
Yeah. It was like one thing after another.
Yeah, layers upon layers.
It also makes you wonder, like, what if that doctor hadn't noticed the skin tone? How long would it have taken to get the right diagnosis? I mean, it's a little scary to think about.
That's a really good question. And it really does underscore how important those thorough medical exams are and open communication between patients and their doctors.
For sure. So we've talked about all the detective work involved in diagnosing adrenal insufficiency. Now let's switch gears a bit. Let's talk about these pressure garments the author had to wear. I mean, I know they're pretty standard in burn treatment, but the author's description of them, it's really vivid, and to be honest, it sounds pretty uncomfortable.
Yeah. Pressure garments, they're essential when it comes to minimizing scar tissue after you have these really bad burns.
Yeah.
What they do is they apply this constant pressure to the skin as it's healing. and that helps to flatten and soften those scars.
And the author described them as basically covering their whole body, right? I mean, arms, legs, even a glove for their hand, everything except like the sides of their hips and butt. They even mentioned all these Velcro openings and straps, and it just sounds like a lot to deal with.
Oh, absolutely. And remember, these garments, they have to be tight to work.
Right.
And that tightness, well, that creates all sorts of problems.
Yeah, I
Uh,
can imagine.
Difficult to put on. They're constricting. And as you said, they're uncomfortable, especially when it's hot out or you're trying to wear clothes over them.
There's this one line, it really stuck with me. The author wrote, "My body could barely breathe."
Wow.
It gives you this sense of how, like, suffocating those garments must have felt.
It's a powerful image for sure.
Yeah.
And it speaks to this link between physical recovery and emotional recovery.
Mm-hmm.
The garments, yeah, they're important for healing, but they also kind of become this symbol of the struggle the author is going through.
All right, it's like they're this physical reminder of the invisible burden that the author's carrying around. And it's interesting because they had these, like, mixed feelings about the garments. On the one hand, they were grateful that they hid the scars.
Yes, they definitely offered a kind of protection,
Yeah.
like a shield from people staring or judging,
Mm.
a way to blend in and not have to answer all these awkward questions.
But then on the other hand, the author talked about just wanting to rip them off all the time, to feel the air on their skin again, even if it was only in those small areas where there weren't scars.
And the author mentioned how there was no feeling, no sensation on the scar tissue itself. So that made the contrast even uh, more intense, I guess.
Yeah.
They could feel the air on the skin around the scars, but the scars themselves, they were numb.
Yeah.
Just this constant reminder of what they'd lost.
And on top of all of that, they had to wear these things for 2 years.
2 years.
I mean, can you imagine the mental and emotional impact of that? Being so physically and emotionally tied to that trauma for that long.
it's hard to fathom, isn't it?
Yeah,
And that's something we tend to forget about, the long-term psychological effects of these kinds of experiences.
totally. We focus so much on the immediate crisis, the acute phase of an injury, but the recovery, that's a long road. And it's often invisible to everyone else.
And that's where the real work begins, you know? It's about rebuilding your life, both physically and emotionally. And that takes time and patience and a ton of support. It really gets you thinking about all the stuff that happens during recovery that people don't see. Not just the physical scars, but the emotional scars, the ones that stick around long after the wounds themselves have healed.
It's so true. It's like the pressure garments almost become this metaphor, this feeling of being held back, restricted, like you can't really breathe freely.
Yeah, that's a great point. It's interesting how the author even describes the process of putting the garments on as like this really difficult, almost like dehumanizing thing.
Yeah. Like that part about their feet being stuck at a 90-degree angle. They couldn't point or flex their feet at all.
Exactly. They couldn't even move their feet right. I mean, how are you supposed to get these things on if you can't even move your feet? It just shows you how fragile their body still was, how limited their movement was, and yet they had to force themselves into these tight garments every single day.
And it wasn't just a one-time thing either. The author had to go through this whole process of taking them off for massage therapy, getting this like temporary relief, feeling the air and the oil on their skin, only to have to like squeeze back into them again. It must have been this constant back and forth relief and then, constraint.
A cycle that went on for 2 years.
Oh,
Can you imagine what that must have done to them psychologically? To be constantly reminded of the trauma, to feel different, to feel marked.
it's hard to wrap your head around. We talk about resilience and how amazing the human body is at healing, but we don't always think about the emotional and psychological side of things.
Right. And the physical scars, those might fade. But the emotional ones, those can stay with you for years, even a lifetime. And they can really change how a person sees themselves and how they interact with the world.
It makes you wonder if there's been any research on the psychological effects of wearing these pressure garments long term. I mean, they seem so important for healing, but it also sounds like they can be really tough emotionally.
That's a really great question. And yeah, there's actually a lot of research going on right now looking at the mental and emotional impact of this pressure garment therapy. And studies have shown that people who wear these pressure garments often experience more anxiety, depression, they have body image issues, and some even feel socially isolated. It's not just the physical discomfort, it's that you're constantly reminded of the trauma. You feel different.
It's like the pressure garments are a symbol of healing, but also like confinement. You know, on the one hand, they're helping the scars heal, but on the other hand, they're limiting movement and freedom.
It's exactly. It's a tough thing to deal with. Some people, they find that the garments make them feel safe, like you're a barrier between them and the world, you know? But then others, they feel trapped, like they're being suffocated. It's a really personal experience, and there's no right or wrong way to feel.
I'm also curious about, like, are there any alternatives? I mean, are there other ways to manage scars that maybe wouldn't be so hard emotionally?
That's a really important question. And researchers are definitely looking for new and better ways to manage scars, ways that would put less of a burden on patients, you know. And there are some promising things on the horizon, like silicone gel sheets and laser therapy. Those can help soften and flatten scars, and you don't need that constant pressure. But for a lot of burns, especially the really bad ones, pressure garments are still considered like the best option.
Okay.
It's all about finding a balance. You want to maximize the physical healing, but you also want to minimize the emotional stress.
It seems like it all comes back to treating each person as an individual, right? Really listening to the patient's needs and concerns throughout the whole recovery process.
100%. It's not just about the injury itself. It's about taking care of the whole person, their mind, their body, how they're feeling emotionally, all of it, every step of the way.
So going back to the author's story, it seems like these pressure garments really shaped how they saw their body and how they experienced their recovery.
Absolutely. The author talks about feeling like a completely different person, someone who was marked by what happened to them, physically and emotionally. They even describe feeling like your body was wrapped in plastic. They
Yeah.
were always aware of the scars underneath.
It's really sad to hear that. But at the same time, you can really sense the author's resilience, you know? Even with all the pain, the discomfort, the limitations, they never gave up.
I agree. And that's what's so inspiring about this story. It shows how strong the human spirit really is. The ability to overcome incredible challenges and find a way forward, even when things are uncertain.
It also shows just how important support is. From doctors, therapists, family, friends, anyone who can offer encouragement and understanding.
Oh, yeah. That support system, it's crucial, especially when you're dealing with the long-term effects of something like this, a trauma. You need people who can listen without judging, who can offer practical help, who can just be there to remind you that you're not alone.
Because recovering from something like this, a serious illness or injury, it can be really isolating. It's not just the physical stuff, it's the emotional stuff too, the changes in your body, how you see yourself, worrying about the future.
Exactly. And that feeling of being alone just makes the whole thing harder. It's so important to have people around you, people you can talk to, who can help you work through those feelings and adjust to all the changes in your life.
So as we're wrapping up this deep dive into the author's personal story, I think it's clear that recovery isn't just about healing the physical. It's about addressing the whole person, the mental, emotional, spiritual.
Couldn't have said it better myself.
Yeah.
I really think the author's story is a powerful reminder that recovery is a journey. It's not like you reach a destination and you're done. You got to be patient with yourself, celebrate the little wins, and reach out for support when you need it. And always remember, you are not alone.
Yeah, it's like everyone's so focused on like the end goal of recovery, but the journey to get there is just as important, maybe even more so.
I think you're right. And that journey, it's almost never a straight line.
Right.
There are going to be setbacks and challenges and times when you want to give up. But it's about getting through those rough patches and being kind to yourself along the way.
And I think the author's story really shows how important it is to celebrate the small wins, those little moments of progress,
Right.
even if they seem insignificant.
Oh, yeah, definitely. Those little victories, they can really give you a boost. It might be something as simple as being able to button your shirt without help or, walking a little bit further each day. It's about noticing those things and letting them motivate you to keep going.
And it reminds us that progress isn't always about these big dramatic changes. Sometimes it's about, little shifts in how you see things, starting to accept yourself more, feeling hope again.
Exactly. And those shifts, they often happen when you least expect it, in those quiet moments
Yeah.
when you're just thinking and reflecting. It's about acknowledging the hard stuff, but also choosing to focus on your strength and how resilient you are.
Speaking of strength, I think one of the biggest things I'm taking away from this deep dive is that real strength isn't about hiding your vulnerability. It's about embracing it.
That's so true. The fact that the author was willing to share their struggles, their fears, those moments of despair, that takes a lot of courage.
Yeah.
And it's by being vulnerable that we connect with each other, you know?
Yeah.
That's how we find support.
Yeah. It's like when we're open about our own vulnerability, it gives other people permission to do the same, and then suddenly we're not so alone anymore. We understand each other.
Exactly. We break down those walls of isolation and shame that often surround these, these traumatic experiences.
Yeah.
And we build this community of support, a community of empathy.
So as we wrap up this episode, what are some final thoughts you want to leave our listeners with?
Well, I really think the biggest takeaway here is that recovery, it's an ongoing process. It's not a finish line. It's you got to be patient with yourself, celebrate those little wins, don't be afraid to ask for help, and always remember, you're not alone in this.
This has been an amazing deep dive. It's incredible how much we can learn from just one person's story, the resilience, their vulnerability, their long road to recovery.
I know, right? And I hope it inspires our listeners to think about their own experiences, to acknowledge the tough stuff they've been through, and to celebrate the strength they found within themselves to overcome those challenges.
Absolutely. And if there's one thing I hope our listeners take away from this, it's this: you are stronger than you think, and you deserve support on your journey to healing, no matter what that looks like. Thanks for joining us on the deep dive. Until next time, keep exploring, keep learning, and keep diving deep.